Hi guys, how are you? Just getting things set up here, so give me just a second. Let me get this shared in my groups on Facebook. I wish there was a way, honestly, that I could do this all prior to, but unfortunately, I don't know that there is. It gives people a couple minutes to get hopped on. Thanks, Shannon, for sharing the video. I'm getting it shared on my side too, so that way people in the groups on Facebook can get, or not can get, but they can join in and hop on over. I don't know why it's not. Hang on. There we go. All right, guys. Sorry, I'm working on it. Is everybody doing good so far today? Oh, thanks, Shannon, for sharing it on Facebook. I'm getting it shared on my business page and things as well. I said, I wish it would give me the chance to like share it, get the link and stuff to share it prior to. But clearly, I am. Sorry if you guys can hear my husband yelling at the dogs in the background. Yep, okay, there we go. It's all shared. It's all good. Again, thanks for sharing that, Shannon, on Facebook. I appreciate you doing that. Did you share it to your page, or did you share it to a group, or? I don't know, because mine wouldn't let me. I had to like copy the link and do it that way. So I'm doing good today. I'm doing really good today. I am staying busy. My husband and I ran a bunch of errands this morning. I'm gonna try to get, hopefully this isn't gonna mess up I'm gonna try to get this light here so that you guys can see the page, the ICD-10 book a little bit better. When I need to get one of the, what's it called? One of the stands that has the light built into it. All right. So let's go over chapter 8 today for ICD-10. So ear and mastoid process. So this chapter 8, does not have chapter specific guidelines. So we're gonna not have those true and false like we have in the or not in the beginning, but in the previous chapters and things that we've done. So we're just gonna jump straight into some of the short answers. So let's look at some of these, highlight or identify our main term, and then walk through finding those in the alphabetic index and then in your tabular. Gosh, my brain today. And then we'll jump into cases. So Let's just start at the top. Congenital auditory imperception. What is our main term? Congenital auditory imperception. Hey, Kimberly, how are you? Sorry, I have some stuff. Okay, auditory. So auditory is what the disease is infecting or is affecting. Yep. So Kayla, it's going to be imperception. Yep. So our main term is imperception because that's the condition. Auditory is where the imperception is or what the type of imperception is. And then congenital is our duration or when it started. All right. So imperception. And then it's got auditory. And then you have one single indentation that is for congenital. So we have H93.25. Oh, Shannon, you're cooking. What are we cooking tonight? So we will come back to our tabular. Pork chops with Alfredo. That sounds good. So H93.25. We have central auditory processing disorder. And that also includes congenital auditory imperfection or imperception. I keep saying imperfection. My words and my brain and my mouth are not connected tonight. Okay. Next one, right ear otalgia. What's our main term? Maria, you just started the self-paced CPC course through Legacy. So these aren't assignments, so you'll still go through the course with Legacy. So you can you can go through these. Yep, so otalgia. No, that's not what I wanted. Oh yeah, you're on chapter 8. If you just want a review of ICD-10, then yeah, you can absolutely stay on here. Nope, we're just doing ICD-10, so no worries at all. All right, so main term is otalgia. If it does start to confuse you though, Maria, I'm not going to get my feelings hurt if you drop off. But yeah, if you want to, then you can stay on. So otalgia. And then we don't have anything about anything else. It just says see your subcategory. So we're going to go to H92.0. I wish I had one of those like book cameras where I could show the iPad and then have a separate camera on the book and then show both screens together. One of these days I might get my technology together. Sorry, I don't mean to cough in your guys' ear. H92.0 is our otalgia. And then we've got right ear. So we're going to do 0.01. Gen C. I have the ICD-10-CM Expert, if that's the book that you're talking about. This is the ICD-10-CM from AAPC. Okay. Next, we have bilateral labyrinthitis. So what's our main term for this one? You're welcome. Labyrinthitis. Yep. We're not going to do every single one of these, but I'm just going to do a couple of them today. Again, since Chapter 8 does not have chapter-specific guidelines, we don't really have any true-false. If you guys are hopping on a little bit later. So labyrinthitis. And then we don't have any of our other things, so we're just going to go to our default code. It is not syphilitic, so make sure we don't go down underneath that because it can sometimes blend in. Oh, sorry. You guys can't see that side of the page. You can, but you can't see it all. So we don't have an indentation, so we're just going to go to the H83.0. So you guys, I have 2 of you all that are on that have done, or 3, Kimberly's on, that have done subscriptions. Did you guys see the process of elimination video that I posted this morning? Did you all like that? That was just kind of a rough one that I put together. I'm trying to kind of, what's the word? I'm trying to figure out what the best way is. So H83.0, we have labyrinthitis, and then bilateral. So it's going to be 5th character 3. So the process of elimination video, that's part of the subscription package. That if you guys want to subscribe monthly, there's going to be process of elimination videos, things along those lines. I'm also going to go live and do book prep. There's going to be like a whole lot that's included in the package. So, one of the other things, and I wanted to kind of run this past a couple of you all that are currently certified. If I were to create a separate level to where you could pay instead of $2.99 a month, say, I don't know, I haven't figured out price range wise, but just a couple more bucks per month, would it be worth it for you guys to do the additional level that you would get everything below it in the basic? That would include Practicode support. So if you are currently certified and you are working towards Practicode, would that be something that for like, let's say $6.99 a month, we would do lives, we would have a lot of conversation around like different cases and things in Practicode. So Crimson is it Cordellini? You're starting school at the end of March. Don't be nervous. Don't be nervous at all. It will all make sense once you get into it and you kind of grasp everything. I promise. It really will start to make sense. So yeah, Kimberly said she would join. Jeannie says that would have been nice when I was doing Practicode. I know. Jeannie, I will be honest, I was so overwhelmed with everything that was happening last year and the growth and figuring things out and trying to figure out what, everything. And I never got around to it last year, but I'm finally getting a little bit more settled into things. Kimberly, yeah, we would work some of them together on lives for sure. Will the subscription include the fill in the blank? Yeah, I probably will. Yeah, I'll have to figure out how to get them to you guys. I don't know if I would just have to make it a link. And you guys would, anybody that's in the subscription would just get the link. I don't know. I'd have to figure out how I would do it. But yeah, I can definitely get that for you guys to where these are included. Bobby, not you yet, but you know your best friend would totally be on board with Practicode. Okay. Yeah, is it Cordellini? Am I saying it the way that it's supposed to be, Crimson Cordellini? Yeah, MedTerm. Yeah, you just need that foundation built beforehand. That's a good thing. Oh, Kate, thanks for subscribing. Sakura, should we subscribe even when we're going to be your student soon? So I don't know how to give the subscription to students of Legacy yet. I don't know if that's even an option for me to do. So let me look into that and see if that's something that I can do. Jeannie, now that you've gotten your A removed, yeah, ask him to reset it. So like tortellini. Okay, so Cordellini. Okay. Yeah, so I was saying it right. Okay. So is your name Courtney? I'm assuming. Is that what it is? All right, so let's do this one here. We have bilateral multiple perforations of tympanic membrane. So what's our main term? Trying to look at for more coding by scratch practice. Yeah, I know that's the hard thing is some courses don't really focus on coding from scratch and fill in the blanks and doing it in real world. Yep, perfect. Perforations. It's our main term. Okay. All right. So we've got multiple perforations of the tympanic membrane. I think I have my screen zoomed in a little bit. Something is different about my setup today. Hang on. Let me try to figure out why it's not showing the book and everything all at once. There we go. I think that might be better. Maria, yes. Practicode will be eventually. So if you're going through the Legacy program, once you are certified, after you gain your certification, then, so once you gain your certification, then let us know that you've passed your certification, and we will get you enrolled in Practicode. Sorry, my brain. I was trying to read the comment under yours, and my brain was not wanting to talk and read and process all of the things all at the same time. So, Dee Dee, you have pet labyrinthitis that never went away. Oh my gosh. How long have you had it? So, we're going to do, okay, so this is of the tympanic membrane. 20 years. Oh, girl. Has it gotten any better? So we'll do perforation, eardrum. Oh, no, we're doing tympanic membrane. I was thinking it gave us eardrum, not tympanic membrane. So we'll go to tympanic membrane. And then it is multiple. So it gives us H72.81. So Tanner, are you asking like what are perforations of the tympanic membrane? So your tympanic membrane is your eardrum. So this person, it more than likely is like from trauma, where you have multiple perforations. Something got stuck in there. Oh, yes. Yep, medical coding. Yep. So H72.81 is your multiple perforations of your tympanic membrane. It's bilaterally. So it's going to be 813. Okay. Let's do our acquired stenosis of the external ear canal, both ears. What's our main term? You're very welcome. Yep, stenosis. Oh, dang it, I keep forgetting to switch my things. Oh, you've been a vet tech for 20 years. I'm sure that has its days where it's very rewarding yet very stressful all at the same time, especially if you have a dog like mine that comes in. I have 3, and she loves people. She just wants to be the only animal around people. So we're going to go stenosis. So we have a stenosis. This is of the external ear. So I'm going to flip the page and find stenosis and then flip it over for you. This is of the external. Oh, I am all the way over. External ear canal. And then it is acquired. So acquired is in our parentheses. We don't have any other information, so it's H61.30. Oh, Shannon, did you have to hop off for a minute? Did you eat, I'm assuming? Yeah, was it good? Was it as delicious as it sounded? Yes. So H6130 is our acquired stenosis of external ear canal. And then both ears. So we've got bilateral. So 0.303. Kaylee, are you talking about in the ICD-10 book or the CPT book prep? Is that what you're asking? I just want to make sure I'm answering the right question because each one of those questions has a little bit different of an answer. ICD-10. Okay. So if that, I just had this question yesterday. So it's totally fine. You probably weren't on. So these that are highlighted, everything that's highlighted is an unspecified code. So basically it's not giving us some type of detail. It's not giving us more like specific information as far as whether it is specified laterality, whether it is if it's secondary to something, things along those lines. So every single one of the codes in here that has a highlight is unspecified in some way, shape, or form. And then anything that's in the green text. So this is not anything I have highlighted. This comes from AAPC's publisher. So anything that's in the green text, that's going to be differentiating. Hang on, what's the word? My brain just stopped. The words that are going to make it stand apart. Let's just put it that way. So they're going to be detailed words. So left, right, the different types, differentiating. I knew I was forgetting like a syllable on it. I'm telling you guys, like sometimes I feel like I can conquer the world with words. And then some days I feel like I'm a kindergartner trying to figure it out. So yeah, green words are going to be basically your detail. And then your highlights are going to be ones that are unspecified in some way, shape, or form. Okay. Does that make sense, Callie? You're signing up for the course this month. Yay. Are you signing up with Legacy? Is that where you're signing up? Words are hard, Bobby. Words are real. I say it all the time too. It's funny because it's so when I'm on live, I'm definitely still me, right? But I feel like there's some things that I'm like, I don't know, maybe I shouldn't say that. But yes, words are hard. So Allison, you're not certified, but you've been doing ENT surgical coding for about 5 years. So this is right up your alley. Oh, Bree, thanks for sharing the live. If I haven't said anything about you guys sharing or sending me little gifts or anything, I promise I'm not ignoring you. I am just trying to look up and down, and I happen to look up at the same time that I've got, somebody shared it or whatever. Okay, let's do some cases. Alrighty. You love hearing somebody else talk about it, yeah. So case number 1, this is an emergency department note. So a 9-year-old male patient was brought to the ER by his mother. His left external ear is warm to touch and it appears red and swollen. He has had a fever of 100 for the past 2 days. Upon otoscopic exam, the middle and inner ear are reviewed with no findings. There is definitely cellulitis of the external auditory canal. Antibiotics are given, and the patient was instructed to return to his doctor in 7 days or to call if the symptoms worsen. So what is our condition? Yep, the cellulitis of the external auditory canal. Yep, and then our main term is going to be the cellulitis. All right, so cellulitis, and then it is of the external auditory canal, and then it tells us to see just cellulitis of the ear. So we're going to pop up here to ear, and you've got H60.1. You know what I think it is? Hang on. I think I figured out what it is. This arm. Sorry, guys. I promise. I'm going back to normal here in a second. That arm is up, or is lower than what it normally is. All right. So, what did I say? H60.1. So we need to figure out our laterality. Is it left or right? Left. Yep. The left external ear. So then it's of the left. So we've got 0.12. Well, that's supposed to be a 2. Okay. Case number 2. 19-year-old female has been complaining of ear pain for 3 days and feeling tired. The exam, eyes appear normal, nose has no findings, cervical lymph nodes are unremarkable, ears, the right ear shows otitis media is present. Antibiotics and drops are given, and they are instructed to return in 10 days. What's our condition? Yep, otitis media. Which one's our main term? Is our main term otitis or is it media? Otitis. Yep. Yeah, we're doing good today. I know the last couple times I've had a couple people that have hopped on and said, I have a really hard time figuring out my main term, figuring out what I need to look for, all of that kind of stuff. So is this really helping you guys with figuring it out and finding your terms and being comfortable? So we're under otitis. And then media. Good. I'm glad it's helping. And then we don't have, do we have acute? Nope, we don't have anything about acute versus chronic versus suppurative, non-suppurative, anything like that. So we're just going to go with our default code, which is H66.9. Yes. Helps to see examples of terms versus conditions. Yep. I know. I had finally, like, I was talking to one of my students one day, and I mean, this was a couple years ago, and I was trying to figure out how to, like, explain it to her of what to look up. And the easiest way was, okay, our condition, our diagnosis might be 3 or 4 words long. Sometimes it's longer, right? But what is the actual condition? Yeah. So H66.9. And then it's of the right ear. So it's going to be 0.91. Okay. Case number 3. We have a 54-year-old male patient that's being seen by me today to review the results of the previous hearing tests and to determine a course of action for hearing loss. Diagnostic testing reveals bilateral conductive hearing loss. The outcome of the testing was discussed with the patient, and the patient will follow up with the audiology department to further discuss treatment options. So what's our condition? What's our diagnosis? Yep. Bilateral conductive hearing loss. Okay. So what's our main term? is hearing. Yep, loss is going to be our main term, because hearing usually, right? Hearing is not the condition. The loss of the hearing is the condition. So I'm going to scoot this up so we can at least see the term here for a second. So we've got loss of hearing, and then conductive bilateral. So that's H90.0. So H90.0 is just bilateral, or conductive hearing loss, bilateral. Okay. Any questions on that one? Thanks you guys for sharing the video. I appreciate it. All right, case number 4. This is the third time in a month, or in a 4-month period this year, that this patient has been seen for myringitis. The patient was also seen last year 3 times for the same condition. The treatment options have not controlled the myringitis. I've referred the patient to Dr. Pyle in the audiology department for further treatment for that chronic myringitis of the left ear. So what's our main term? What's our condition? Yep. So we've got myringitis. And then it is in, do we have laterality? 3rd time, 4-month period. Left ear. See, I'm telling you guys, sometimes I read it and then I like totally forget. I totally forget what I've read. That is my ADD. That is why I am a visual learner and an audible learner and not a reading learner. And I have accepted that and realized that I am just not a reading learner. I have to do it, get my hands deep and wet and dirty and all the things. All right, so myringitis. And then it is chronic. Shannon, you're the same way. Yeah, Ashley too. Wheel Diva, or where are you going to school? Where are you taking classes? So H73.1. Yeah, it says me 3. Austin Community. Did we talk about that? Because that sounds familiar. That, unless there's somebody else that's going to Austin Community College. I swear, one of my lives, somebody else had said they were going there as well. Well, so H73.1, Leisha, and then we've got to further expand, and that's going to give us our laterality. So we're going to use our 5th character, number 2, to indicate left. That's why you always want to verify in your tabular. Always, always, always. Do we code for the past? Do you mean the fact that they've been seen 3 times in the last year? No, because it's still a current condition. If it had resolved, then we may potentially, depending on the verbiage. But since this is a current condition, and then the fact that it's chronic, that's going to be our indicator that we don't need to code anything from the past. You're welcome. So MJW says 5th characters are a struggle for me. For the 5th character, usually your 5th character, you just have to make sure that you're choosing the correct laterality, correct location, something along those lines. Okay. Case number 5. 31-year-old male is being discharged today for following correction of deformity for the right pinna that he acquired during an automobile accident. His stay was uneventful. The surgery corrected the deformity, and there were no complications. He is instructed to follow up with the discharge orders that were given to him, and then follow up in my office in 1 week. So Kayla, when you have multiple codes, how do you know which order to list them? If you have chapter-specific guidelines that tell you sequencing, then you want to follow those. If you do not have chapter-specific guidelines, then you are going to typically go by the reason for the encounter as your first listed, and then anything else can be listed in after. Okay, so Shannon, the pinna is the location. What's wrong with the pinna? The deformity. Yep. Yeah, Kimberly's right. The guidelines are going to be your best friend as far as sequencing. 100%. Okay, so we're going to do deformity. And then pinna, and it's acquired because it was acquired during an automobile accident. So it tells us to see also disorder pinna deformity. So we're going to go to disorder. And then pinna. And then deformity. Amy, thanks for subscribing. So it's an acquired still, so H61.11. And then we've got to go back to the tabular and expand. So we've got H61.11, the acquired deformity of the pinna, and then it is of the right ear. So our sixth character is going to be a 1. Roadrunner. These questions, I don't know if these are available just yet. I know Rachel has been working on the website this weekend. But the medicalbillcode.com/CPC website that's in my bio, then if you go to that website and then you go to the resources tab, there are a bunch of questions broken down by section, and that's what we go over on our study sessions every Wednesday. And then these will be available at some point this weekend. I'm hoping she's going to get them up tonight. If not, then it'll probably be tomorrow. I know she's a little busy this weekend. These questions will be available by section on the website as well. They are not available as of right now, because I literally just looked as I was talking about it. But they will be. I think we figured out pricing was going to be $5 per section, like per chapter. And then I think it was $90 for all of your ICD-10. But there's at least 10 cases for each one, at least 30 fill in the blanks or short answers. And then the chapters that have chapter-specific guidelines, there are 5 to 10 true or false on the guidelines. Will this be taken over by AI? It won't be taken over, but AI is going to be used to kind of help with production and accuracy and things along those lines. But it will never completely be taken over. There will always have to be a human element to coding. Shannon, you're joining the sessions on Wednesday. Awesome. I can't wait to have you. Is this for CPC? Yes, this is for professional coding for your CPC certification. All right, case number 6. 84-year-old patient presents today with a complaint of loss of hearing, tinnitus, and pain in her left ear. Vital signs, BP, and then your weight. Ear, inspection of the right ear, there's no finding. Inspection of the left ear, there is impacted cerumen in the ear. So mineral oil was placed in her ear, and then the ear was irrigated and the wax was removed. Y'all are making me blush over here. Shannon and Kimberly, y'all are making me smile and blush. So what's our condition for this one? What are we coding? Okay, tinnitus. Is there something that's causing the tinnitus? The impacted cerumen. Yep. So what's our main term? Okay, let's look at cerumen. Usually, I wouldn't say that let's go to that, but I don't. Oh, yep, it is there. I would have gone to impacted, but yep, it is under cerumen. So you could have gone impacted and then cerumen, or you can go cerumen and then impacted is in your parentheses. So we talked about this the other day, and I made you guys pull some knowledge out of the cobwebs. What are the words? Not necessarily the actual word, but if you see a word in parentheses, what are those called? Do you all remember that conversation from the other day? While we're looking up H61.2. So this is something that you would need to know your guidelines. It tells you if you see a word in parentheses, what are they referred to as? Non-essential modifiers. Yep. Good job. So H61.2 is our impacted cerumen. And then it is on the left. So 2-2. So we're not going to do the loss of hearing, the tinnitus, or the pain, because all of those are signs or symptoms of our definitive diagnosis, which is the impacted cerumen. Okay. Case number 7. Patient is returning to the office today to discuss having a stapedectomy for obtaining a hearing aid to treat bilateral otosclerosis. The patient has discussed this with his family and he would rather not have surgery at this time. I have referred him to the hearing clinic to be fitted for hearing aids in both ears. Yeah, Shannon, I'm the same way. I have to do it. You can sit here and tell me 800 times, but until I get my hands on the book, same way at work. Like if we're learning a new software or something to go with, our things, then I can sit and I can sit and hear people talk about it. But until I get my hands on it and I click through, that's where my brain makes sense. Okay. So case number 7, yep. Our condition is bilateral otosclerosis. Perfect. So we've got otosclerosis. Do we need to go to any of the ones underneath indentation-wise, or do we want to go to our default code? Yeah, Shannon, what's your question? What you got? So there's not any detail as far as if it's involving the oval window or anything like that. Yep. So we're just going to go to our default H80.9. Okay. I don't know where 98 came from. H80.9. So would we add a modifier since it's bilateral? No. Modifiers are only appended to CPT codes. Where your laterality comes in with ICD-10 is going to be your 5th and 6th characters. So that's why we've got 5th and 6th characters that tell us left ear, right ear, things like that. Yep. All right, so H80.9. So see here, we have a left, right, and bilateral option. So it is bilateral, so we wouldn't need modifiers, right? Because ICD-10 is specific in laterality, whereas CPT is not specific in laterality. So that's where we need the LTRT or 50. So 0.93. Good question, though. Don't ever hesitate to ask questions. That is what I'm here for. I promise there's no question that I have not heard before. I have pretty much heard it all. I probably had those same questions whenever I was learning it too. So don't feel bad. Don't hesitate to ask any questions that you've got. Case number 8. 10-year-old is complaining of ringing in his left ear and a headache for the last 3 days. He has had a fever of 101 for the last 2 days. Otoscopic examination is suggestive of acute mastoiditis. CT scan revealed inflammation of the mastoid bone in the left ear. Antibiotics were prescribed, and he was instructed to follow up with his primary care provider in 5 days. Angie, I don't have a set schedule as far as the days that I go live. I need to sit down and actually make one, but I just have not created one. I typically tend to do it more on the weekends. So Friday, Saturday, Sunday, and then sometimes on Mondays, depending. Yep. So it revealed inflammation of the mastoid bone in the left ear, which is going to be our acute mastoiditis. Now, had they not done a CT scan, would we have been able to confirm, or would we have been able to code the acute mastoiditis without confirmation? Right. Because it's suggestive of, there's not a definitive diagnosis. Maya the Gemini, I did not see a question from you. Hopefully it's not starting to filter out comments again. What was your question again, Maya? Will we have to code the symptoms if it wasn't suggestive? I'm not sure what you mean by that, Nat. TikTok erased your comment. I swear, it has a habit of doing that. Yes, Anna, on the CPC exam, you can't use the Optum book. It has to be, well, your CPT has to be the AMA Professional Edition. Few examples up, it said definitive of blank. Okay, I still don't know what you're talking about, but if I answered your question, then that's all that matters. Sorry. So we've got mastoiditis, and then we want to go to acute. Oh, up here, suggestive of. So if it says suggestive of, then you have to have something confirming the diagnosis. If it's not a definitive diagnosis and we're just assuming, like we're just saying like, it resembles something. If we don't have a definitive diagnosis, we would not code the acute mastoiditis, and we would code the ringing and the headache. But because we have a definitive diagnosis, because our CT scan confirmed it, then we're going to code the definitive diagnosis. Sorry, I read it and totally forgot that the actual question said suggestive. I thought you meant like it was a couple questions back. Okay, so mastoiditis, acute. It's not complicated or anything like that, so we're just going to go with our default. So H70.00. And then, sorry, I just had a bunch of comments come in. I'm trying to make sure that I don't skip any comments and I'm answering them, but so H70.00, this is of the left ear. So it's going to be 2. All right, so let me answer some questions real quick. Because like I said, there were a bunch that came in all at once. That's why I was getting a little confused. So you purchased the notes on the website. Do we need to write the RVUs for the CPC exam? No, the RVUs are not going to be needed for the CPC exam. Those are for when you're in the learning process and you're coding from scratch and you are trying to figure out your sequencing on your CPT codes. So just Kiki, how would we know if a CT was not performed? So if a CT was not performed or we don't have a definitive diagnosis, then you would just code your signs and symptoms unless they tell us that there is a definitive diagnosis. Yep, Camellia. CP or CM, ICD-10-CM is your diagnostic codes, the conditions, the reason for the encounter. And then your CPT codes is going to be for your procedures and services. Yep. Michelle, there's not really billing questions on the CPC exam. There are going to be questions about compliance and regulatory, things like that, but not billing, like not true billing. Myra says, I'm currently studying to take my test in April. What would you say is the most on the exam? Are you taking the CPC exam? Like, are you asking what do they focus on the most? So let me actually show you guys this here real quick. I'm going to go to AAPC's website. And I'm going to show you guys. So anybody that has questions about what is on the CPC exam, the layout, anything like that. So if you go to AAPC and then you go to the certifications page, click on the CPC or whichever one you're doing. If you're doing the CPB, things like that, you'll come over here to taking the exam and then scroll all the way down. This will tell you what books you can have. It tells you what's allowed as far as notes, tabs, things like that. And then it gives you a breakdown of your questions. So you've got 8 total for MedTerm and Anatomy, 3 on compliance and regulatory, 7 for coding guidelines that could be either ICD-10 or CPT. You've got 5 specific for ICD-10, 3 specific for HCPCS. And then each one of your sections for CPT, with the exception of anesthesia, are going to have 6 questions. Now, these that are in the 10,000 series all the way through medicine, well, all the way through anesthesia, some of them could potentially have ICD-10 questions, right? They could have ICD-10 codes in there with the CPT codes. So it's not going to be these are only focused on CPT. They could include ICD-10-CM. So keep that in mind. And then you have 10 cases. Everything is 100% multiple choice. You have 100 questions total and 4 hours to complete. Does that answer your question, Myra? Okay. You're very welcome. All right, so let's go back to case number 9. 10-month-old patient is brought to the office by his father. Hang on, sorry, I just got a weird thing on my... Okay, I just wanted to make sure I wasn't getting a warning for something. I have to get down and look underneath because of the way my phone is to hold the camera. So 10-month-old patient is brought into the office by his father. The father states that the child is pulling on his right ear, has been running a fever, and has been crying for no reason. Temperature is 100.4. Otoscopic examination reveals a bulging tympanic membrane in the right ear, which is red and swollen. Left ear is normal. The assessment is acute suppurative otitis media. Plan is Tylenol for pain, and then amoxicillin is written. So what's our condition? DJK, does the course teach how to code from scratch? Yep, it sure does. If you go through the legacy course with AAPC, then yes. Okay, Shannon, so the ear infection, we need to just kind of not try to, I don't want to say dumb it down, because I don't want that to, that's not really what it's doing, but like, don't necessarily try to take it into layman's terms. If they give you medical terms for the condition, use your medical terms. So our condition is our otitis. No, you're fine. You're totally fine. You're learning. It's totally okay. Acute suppurative otitis media. So our main term is what? Usually it's the other way. Usually sometimes they're telling you things in layman's terms, and then you have to think of the med term. So don't try to overcomplicate it. If they're giving you your medical terminology, use your med term. Yep, it's otitis. Yep. Main term is going to be otitis. And then we're under media. It is acute. And then we've got to flip the page to find suppurative. And then so it tells us, see otitis media, suppurative, and then acute. So we'll come all the way down here to suppurative. And then acute. There's no mention of the rupture of the eardrum. They talk about it being swollen or bulging. Yeah, red and swollen. But it's not actually ruptured. So we're just going to go H66.00. Right? Hang on. Otitis media. Suppurative. Yeah, H66.00. So we're going to come out here, H66.00, acute suppurative otitis media, without spontaneous rupture of eardrum, and then it is on the right ear. So what's our sixth character we're going to use? Sierra, I would, if I were you, I would still join these while you're in your course because it kind of helps tie everything together. Yeah, like Kimberly said, she's still in the course and it helps. And then, yeah, Mira says the same thing. Yeah, the extra words can definitely get tricky. Yep, 0.001. Okay. Let's do case number 10. 86-year-old female has been tested for hearing loss, and I'm seeing her today to discuss the need for a hearing aid. She's not able to hear well in both ears, as confirmed by testing. Due to sensorineural hearing loss. And today I'm writing a script for her so that she can be fitted for her hearing aids. So what is your condition? Bobby, that's a good idea, even before you've really started. Because are you doing the March class or the April class? Remind me, Bob. I think you're doing March, right? Yep. So yeah, it's good that you're getting exposure to it. So that way it's kind of making a little bit more sense, for sure. That need placeholders, Myra. Okay, so yeah, we will definitely self-paced. Okay, I knew you had signed up, but I couldn't remember. I was thinking maybe it's Jody that I'm thinking of. Okay, so hearing loss, the sensorineural. It's a hard word to say. So our main term is loss. Sierra, these will be available at some point on our Legacy website. We just have not gotten them loaded into the website yet. So they will be coming, I promise. I gotcha, Bobby. Okay, so we're underneath loss, hearing, and then we've got to come up here to the top column, or to the third column at the top. And then here's our sensorineural. And then it is both ears. H90.3. Oh, nope, hang on. Nope, yep, it's just H90.3. So lit in real life, you don't want to go down to sensory. It is sensorineural. So they look very similar, but they are different. So you'll do H90.3. And it gives us the sensorineural hearing loss bilateral. I saw your H90.5 and I had to second guess myself because I wanted to make sure that I wasn't doing my eyes weren't playing tricks on me. Okay. We actually got through all 10 cases for that chapter tonight. I'm proud of us. I didn't go off on any random things. No, you're fine. Don't apologize. Because if you all have watched my lives before, especially, was it yet? No, it was Friday. Friday's live, my brain was here, there, and everywhere. So I was making mistakes left and right. So it's totally fine. Do y'all have any questions? You want me to talk about the course? Is there anybody that's interested in anything that's on the website? Do you all want me to show you things that are on the website? Do you have questions about the exam in general? Anything I can help answer questions? If you guys are, and I'll kind of talk about this for a second. If you all do not subscribe and you are in school, okay? So if you are not a student of Legacy, or even if you are a student of Legacy, and you are wanting to subscribe. So with a subscription for here on TikTok, Then for $2.99 a month, then there will be weekly live videos only for those that are subscribers. In the live video, we will go over some book prep. I'm purchasing a whole separate copy of the CPT manual, and I'm going to prep the books again. So like I did, I don't know if anybody was able to hop on lives and do book prep, but I am going to get a blank copy of the CPT, and then lives, we're just going to sit and prep books and answer questions. Okay. So that's a perk of the subscription. Also a perk of the subscription, I'm going to do a daily, at least one, if not multiple videos a day, but I'm committing to one per day of process of elimination videos for you guys. These are going to be very specific for those that are in the subscription. Things along those lines. I will also, and I'm going to figure out how to do it, but these questions will be available to you guys. And I'm going to figure out, like I said, I don't know how I'm going to get them to you guys, but I will get them to you guys that subscribe. And then also any requests that you all have for videos, then you can 100% submit like requests and say, hey, I'm really struggling with this, and I will get it on the list, and I will make sure to make videos that you guys are asking for, type thing. And then also you all get communication priority, so email, or not emails, direct messages, comments, things like that. Like I'll get to you guys first type thing. And then, hang on, I had one other thing. There was one other thing in my live, and I'm trying to remember what the other big thing was that I told you guys I was going to do. I'm looking it up here so I can make sure I'm telling you guys correctly. Oh, and then you guys get to help me decide topics for lives. And then the process of elimination that we go over are going to be questions that are written directly by AAPC. So if you guys are interested in subscribing, I would greatly appreciate it. I would greatly appreciate the support. And then, like I said, it's just going to be a big community for us to kind of tailor things for you guys a little bit. So let me go back to some questions here real quick, because I know while I was kind of rambling about that, there were some questions that came in. For the CPC, so SABI. For the CPC, we need to know ICD-10 and CPT. You also need to know HCPCS. So the entire CPC exam is going to be HCPCS, ICD-10, CM, and CPT. And then you're going to have a couple med-term anatomy and compliance and regulatory. Andrea, yes, if you are signed up with Legacy, book prep is 100% included. Question, for the exam, can we use a notepad in the exam for just med-term and keep it up throughout the exam? No, well, yes and no. They do have a notepad built into the exam software, but they do not have, like, you can't pull up a separate notepad outside of the exam platform. How many questions are on the CPC? The CPC exam is 100 questions. You have 4 hours. Oh, you're going to retake your exam this year. Elfin, when are the lives? So I was looking, let me see if there have had more people answer it. But with I put a poll in there. So if you guys are subscribers and you have not answered the poll, make sure you go out and let me know what days will work best. I am thinking it's going to either be Monday night or Saturday morning. So make sure that you go out and answer this poll if you're a subscriber, so that I can do it when the most people are available. Thanks, Sierra, for subscribing. Mrs. Jones Tay, do you have book prep done for ICD-10? Yep, on the website. Absolutely. So let me go to the website real quick. It is medicalbillco.com/CPC. And then on the website, there are a couple of options. You can either purchase all of the, not necessarily all, you can do all of the CPT all at once. You can do individual sections if budget doesn't allow you to do it all at once, or you only want certain sections. Or you can do ICD-10-CM. If you do the CPT all files, that is only CPT, so you will still need to do ICD-10-CM. Make sure that whenever you go into your CPT, whichever section it is, or even ICD-10, you are choosing the correct year. So 2024 versus 2025. Life with Damaris Lynn. Can we have all of the notes in your books? Yep. I have taken exams with those notes. Multiple students have taken exams with those notes, and everything is good. Bobby, are the sub lives scheduled at certain times and dates? So I haven't set a schedule yet, Bobby, but once you subscribe, you can put in the poll which day works for you guys. So the subscription lives will likely be on either Monday night or Saturday morning, but I'm waiting until more people put their vote in before I make sure. But for unsubscribed, so like for lives like this, I don't have a specific schedule set up. I'm trying to see when my subscription lives are going to be. And I am honestly, and you guys are the first ones that I'm telling this to. So right now my classes are Tuesdays and Thursdays. Well, Tuesdays or Thursdays, like the live classes that you would take with Legacy. I am highly considering putting a Wednesday class. So adding a whole separate, because as of right now, my April class, the third class only has like 2 seats left. So if the April class fills up, then I am considering doing a Wednesday night class, and that would be a May start date instead of the next one would be June. So just keep that in mind. So that's kind of why I haven't really set a schedule yet, because I want to make sure that I'm not having to move, like set it and then move it and set it and move it and all of that kind of stuff. Can you go over where to look for medical and anatomy questions in the books? So you don't really have a whole lot of med-term and anatomy that it looks like med-term and anatomy from a book standpoint. But like, let's say for instance, you have a question that's asking you, where is the vermilion located? Okay. So you can come into your index and you can look for vermilion. And you have vermilionectomy, 40500. So it's a 40,000 code, so we know that's digestive. So if we come into 40500, you see that a vermilionectomy is a lip shave. So that would tell you that is where that your vermilion is your lip. So that's just that's a way that you can use your CPT manuals or even your ICD-10 to find. So go to the term and see if it will give you where to go. Oh, you're wanting to do the CRC course. Yeah, so if you want to do CRC, let me go over that real quick. So the CRC course, it's a self-paced course. You obviously have me as your instructor. You can reach out to me by email. You can schedule a Zoom 30-minute session for coaching, things like that, but it's all included in the course. It includes the course itself, it includes the textbook and the workbook, obviously any coaching time like we just talked about. You have 12 months of access to the program. It does include your internship for HCC. So you do have to be CPC certified in order to complete the internship. But most of the people, I'm assuming, since you're wanting to do CRC, Mrs. Jones-Tay, do you have your CPC already? So the website is medicalbillco.com. Oh, thanks for the subscription, Life with, is it Damaris Lynn? Is that how you say it? Thanks, Liz, for subscribing. You all are amazing. Do I teach CRC coaching or coding? I have the CRC course. I do not have live sessions for CRC at this point, but I do have the CRC course, and then I will do coaching if you are a student with us. Kimberly, I know, I'm going to be busy. I'm already busy. Me and my husband were talking about it today, and I was like, I feel so bad that like I'm doing nothing but work, and he is so supportive. He's like, do what you got to do. It's totally fine. So if the exam is taken online, there aren't notes. Is that a harder pass? So if you take the exam, meaning remote proctor, Elfin, if you take the exam remote proctor, you can still use your physical books and then it has notes. But if you use the ebooks, then correct, there are no notes in the ebooks. I am not a huge fan of ebooks. I do not think that they are going to make you faster or give you an advantage or anything like that during the exam. So don't... I'm a proponent of testing in a testing center and using physical books, because I have heard so many horror stories about remote proctor and the things that they have run into, that students have run into from a testing perspective, or connectivity or proctor issues or whatever whenever you do live remote proctor. So just keep that in mind. There are going to be advantages and disadvantages of both, but it's just going to be a matter of what is going to benefit you the most. But if you are taking it at home, just know your internet has to be fantastic. Your computer can have 0 things open. And they are going to watch you like a hawk. And they are going to make sure that everything in your room is completely clean, and you cannot have, so like my desk right now, because I have 2 monitors plus my work laptop plus all of my certifications on the wall and everything, there is absolutely no way I would be able to take an exam in my room because there is so much going on. Sarah, so you signed up a week ago, down payment came out. What day did your down payment get drafted from your bank account? That's going to be the deciding factor. Is the billing course the same as the CPC? No, the CPC course or the billing course is going to focus only on billing. It is structured the same way. So it was last Tuesday, as in, hang on, let me look at my calendar here. Last Tuesday as in the 25th. Is that what you're saying? Or was it the Tuesday before that, Sarah? The 25th. Okay. So that will likely the funds will get released to us on the 4th. It takes 5 business days for everything to like release over to us. It's just the way that they have to do their processing. And then that takes 5 business days. So anything that was processed on the 25th will likely be released on the 4th or on Tuesday. And Rachel will either get your enrollment email out Tuesday or Wednesday, because we just say give us 24 business hours. Just that way we, if we get it later in the day, then, she may not get it out until Wednesday. So just keep that in mind. But you should hear something Tuesday or Wednesday of this week. Yeah, April. So you do have to do a 360-degree turn of your room when you're doing it at home. They have to see everything. And if you look like you're looking into... Oh, okay, Rachel. So that they will send an email. I don't know. See, I don't know how that works. Yeah, so SweetPay will send an email to you once the account funds. Perfect. But yeah, so back to April's comment. So they do have a 360-degree turn of your room. If they see that you are looking up a lot, or they see that they can't see your hands or things like that, they might in the middle of the exam stop you and tell you to rescan your room. They are super strict. And that is just because they are protecting the integrity of the exam, right? We've only been testing at home for a couple of years, so they are protecting for sure. They're making sure that you're not cheating, not you, but they're just making sure that people are not cheating. They're making sure that, it is going to, Bobby, I do it too. They're just making sure that there's not any funny business going on. So that we can assure 100% that everybody's got the same environment and things along those lines. Ellie, this is about medical coding. Yeah, I have, experienced testing at home. Yeah, I've heard some horror stories about testing at home. I would agree but disagree with that at the same time, because I would feel like for me too, because I have some pretty bad test anxiety. But knowing what we know about the testing environments, so if you go to a testing center, they are quiet. They are 100%, if anything goes wrong with the computer, it's not on you at the testing center. But if you are at home and your power goes out, if you're at home and your internet goes out, you forfeit your exam. You forfeit your attempt. So if you are at the testing center, then the testing center, if their power goes out, then it's not your fault type thing. So that's why I highly recommend testing centers. I have tested at testing centers, and they are very quiet. It's actually nowhere near as stressful as a lot of people think. I always tell people, schedule yourself to show up an hour early, so that way if you are running late, you're still early. Also, I don't know about you all, but I have 3 dogs and a husband. And no matter what I tell them, if I say I cannot be bothered, I'm on a call, I'm doing whatever, it never fails that they always try to walk in. If I close the door to my office, my dogs will sit out and they will scratch and they will whine and they will cry. So yeah, it is, I highly, highly recommend going into a testing facility. If you are stressed about what it's going to look like from a testing perspective on the software, I'm actually going to pull up on my computer. So let me get it pulled up here, and then I will show you guys what the exam actually looks like. Because your AAPC official practice exams, those are going to be in the same format and the same software that your testing environment is going to be in. So, like I said, if you are nervous about that and you don't want to have that be something that you're worried about, then I'm getting it pulled up here. It's just taking just a second, and then I will get everything moved around. so that you guys can see. I would pull it up on my iPad, but I was trying to do that earlier and it did not want to pull it up. So I actually have to move you guys around here real quick. No, hang on. No, come on. Sorry, my thing is not being cooperative. I gotta move my laptop down too. Okay, so once you are on your AAPC site and you purchase oh, that's not what I wanted. And you purchase a practice exam, you're gonna go to your courses and exam file. Let me move this down so I can see your guys' questions too. And then you're going to come down here to your practice exams and log in. And then you want to launch. And then it's going to go through this little test here real quick. Once everything is good, then you'll proceed. It tells you the breakdown. I'm ready to begin. And then this is where, so again, this is the exact software that you'll be in when you're taking the exam. Okay. So you've got your questions here. This will tell you what section you're in. You're on question 2 of 3. If you want to flag this question because you don't know, you can flag it and it'll turn it orange and then you can move on. And then it'll take you to the next. Now, if you come over here, oh, you can't see this part. If you come over here to this side, you see this little button here. If you click on that, it expands it. And this is your test, right? This is your questions. This is your breakdown. This will tell you if your questions are flagged. Gray is going to be questions that you have answered. White are questions that are unanswered. And then the one that's in black is going to be the question that you are currently on, right? Because we're on 3 of 3 of the 20,000 series. So it's got the timer. You do have a calculator. So if you have to do very simple math, right? So we know that if we have our anesthesia formula, we might have to figure out square centimeters, things like that. You have this at your reach just in case you need it. You do have a notepad in here. So if you are one that likes to do process of elimination, you can come out here and put A, B, C, D. I'm ruling out letter C, so I'm going to put an X. So that way I have that visual reminder. And then you have this beauty, okay? E&M calculator. If we have, let's say, just date of service, I'm just going to pick a random date. And then we're doing an office visit, and it's a new patient. Come out here and hit save. We have 2 chronic stable illnesses. We have diabetes and hypertension that are stable. We have 2 tests that we reviewed the results of, and then 1 test, new one that we ordered. And then if we come down here and the provider did prescription drug management, they just wrote a new prescription. It gives you your overall MDM. And then as long as you select your correct setting and the type of visit, and you scroll down, it tells you your individual levels of MDM and then your overall MDM. And if you selected the correct level up here, it gives you your actual CPT code. So for a new patient office visit with a moderate medical decision making, it gives you your 99204. So they do give you access to this E&M calculator during your exam. That does not mean don't study E&M. That does not mean do not learn the tables. This just means that you have the base knowledge and you know what to accurately select in the MDM calculator, and it is there. If you're doing time-based coding, you have a tab that if they give you the specific time, or if you're doing critical care services, I'm trying to get it to click on it, but it's not wanting to do it for some reason. Oh, probably because I'm not in critical care. Then this will give you your total time in minutes here. So this E&M calculator is great. If you have not purchased a practice exam, then you can come out here to the AAPC website, go to Software and Services, Calculators and Tools, bada bing, bada boom. You've got your E&M calculator. It's the exact same thing that's in your exam, your practice exam software. It's just outside. So if you are doing E&M at work or you're studying it, you can come out here and use it. You also have out here an RVU calculator. So this tells you what are RVUs, why are they important. It gives you all the information if you're not super familiar with RVUs. And then you can put in your codes. And it's going to give you your RVUs. So if you want information about RVUs, you do have an RVU page. It even gives you more information as far as what are RVUs, why we use them, understanding them, conversion factors, global surgical packages. There's all kinds of stuff out here that's available. Now, one thing that I do want to talk about for a second too, because I've had a lot of people reach out and say, I'm certified, but I can't afford CEUs. Within your membership, okay, this is very important to think about. Within your membership, right, that you have to pay every year to keep your certification, they give you plenty of opportunities to do CEUs without having to pay extra. If you go to resources and then AAPC, the magazine, you get one CEU per AAPC magazine that you do. You just have to test yourself. You have to complete a test yourself quiz. You can download the PDF of the magazine so that you can use a search function. You can have an e-magazine, or you can be like me, and I really like still having the paper copy of it. So you get 12 of those per year. Also, you get your, where's it at? Hang on, I gotta remember how to do this because, your local chapter meetings. So your local chapter meetings can be as many, you can go to as many as you want. If you want to go to the ones that are in your city, you can. So this will give you details. I'm in Louisville, Kentucky. Yeah, Rachel, and you can go up to 1 year back. Absolutely. So these are the CEUs. These are going to be the meetings that they have scheduled. So you see one of them is worth 1, but one of them is actually worth 1.75. Now, there is a group on Facebook, and a lot of your chapters will still have virtual. So like this one here, it's still a virtual event. So you can click here and register. Oh, it's going to connect me. I thought it was going to do the details of the meeting. But yeah, so you can come out here and you can join up to, well, really, you can join any of them as long as they're virtual. If you want to travel to other chapters, then absolutely you can. There's nothing stopping you. But if you need CEUs, you can go out and search for the different chapters and see what's out there that's virtual. There's also a Facebook group out there that you can go out there, and I don't remember the name of it. I'll have to look at it and show you guys. But there is a Facebook group that will allow for like posting of virtual meetings. So that way you can be up to date with all of that. So don't feel like you have to spend money to do your CEUs. It is absolutely possible for you to do CEUs without having to pay anything. Again, between everything. Now, if you want to know how many CEUs you have to have, because everybody's going to be, sorry, I have the hiccups. Everybody's going to be different, right? Because the number of certifications that you hold is going to determine how many CEUs you are required to do. So, I've got to figure this out because, is it maintain your certification? Yep. They keep changing the website on me. So if you hold one certification, every 2 years you have to have 36 CEUs. So that's 24 months. So if you go out there and do all of your AAPC magazines, that is 24 of the 36. And then you just have to have 12 more that you can get done with your chapter meetings. Again, it doesn't have to be the one that you are in, but it can be, any of them that are virtual. DJK, is there a class that you can take every year to get all of your CEUs? I don't know. I will be honest. You can do webinars and get them all that way, but I don't know that there's ever going to be one that will suffice all of them, if that makes sense. But yeah, a lot of your corporate jobs will offer CEUs for free. I know my corporate job, they pay for my membership, and then they also pay for my webinars. So I have a webinar subscription where I can go out and do webinars, and I don't have to worry about doing magazines. I don't have to worry about doing meetings. I can just go out and do webinars during my downtime at work, and then, it meets everything. So there's that. And then you do have a CEU tracker. So I have 7 certifications. So I have maxed out. So you will never have to get more than 52 per year. If you have a specialty credential, they will have to have so many CEUs in each specialty. And that's pretty, normal. So, Elfin, if you miss a course class, is it recorded? So, yeah. So, if you're doing a legacy instructor-led class, yes, we record all of our instructor-led classes, and they are available the next day. So, I'm just going to show you guys what my CEU tracker looks like. So, I have some courses that have earned me CEUs. I have some post tests for magazines, and then I went to a conference a couple years ago in November. So I have all of my CEUs from there. And then it'll show you the breakdown down here at the bottom as far as how many are required for each one of your credentials type thing. So that's what your CEU tracker and stuff will look like. Now, if you have a specialty CEU, or if you have a specialty and you need a CEU specific for that specialty, so see how I have it marked over here on this specialty? Every time whenever you automatically enter them, it's going to go to your core credential, but you can come over here and hit edit. And then if it is eligible to move it to another, nope, it's not doing it on that one. If it's eligible to move it to another specialty, then it will pop up with this screen and it will let you move them around if you need to. So I could move it. I could do a half of a CEU for one. I could do half for the other, whatever it is. Okay. Y'all have any other questions? Oh yeah, Rachel, I keep forgetting about that. Yeah, if you are CPC certified or CPB, and then you do your CPC, whatever it is, as long as you hold a current credential, whenever you take another course, like for example, with this one here, I took the cardiology course. It does give you CEUs for every course. Depending on what type of course, it's going to vary. So yeah, Rachel said that the CPB course is worth 40 CEUs. Do you know how many the CRC course is worth? Is it 30 something? So yeah, I guess Rachel, or I guess DJK, that would suffice your CEUs. 30. Okay. Yeah, so it would meet all of the requirements for your CEUs for the year. I wasn't thinking about that. What else is on the AAPC website? If you want to do webinars, you can come out here and look at different webinars. So you can just kind of see, like every year whenever the new code sets come out, they do webinars on the updates for the codes. So if you wanted to register for that, then you could get one CEU and then learn about the updates for the code sets each year. Oh, you're thinking about taking the legacy course. Which one are you thinking? Are you thinking about doing the CPC? Do you already hold the certification? Is that why you were asking about if courses count for CEUs, or are you just kind of figuring out what to do after you get certified? Oh, you're a paramedic now. So, I mean, you'll still have some of that knowledge that you'll pull in. Absolutely. Graduating soon from an online course. Where can you find a resume writer? So, Sarah Reagan is amazing at her resumes. If you go to the link in my bio, let me pull up. So, obviously, this is not on the phone, but this is desktop, but it looks exactly the same. If you come out here to this link tree, if you go up to the bio and then you click on that, then it brings up all of the, like my pinned links and things. Sorry, my brain is starting to starting to not work. So if you're wanting the legacy page, these two are the legacy pages that take you to medicalbillco.com/CPC. This is the registration link for the Wednesday night study sessions. Here is the link with the recordings on YouTube, as well as the questions that we go over. We have a YouTube channel. Here's my Facebook page. And then this one right here is Sarah Reagan. She is our resume writer, and she is hands down phenomenal. So if you are interested in resume services, Sarah Reagan here is great. Yes, so our course with Legacy is the AAPC course. It is exactly like AAPC because we license the material from them. Rachel and I are both AAPC licensed instructors. And so it is literally the course that you would get if you went directly through AAPC. You just get all of the perks of going with us on top of the AAPC course, and our prices are cheaper than AAPC. So everything included in the course, if you do this self-paced course, you get for $2,700, you get the course itself. I'm going to zoom in on this real quick. You get the course itself. Sorry, my screen just did something. I'm making sure I don't. There we go. You get the course. You get the textbook and the workbook. You get all 3 coding manuals, physical copies, same with the textbook and the workbook. You get any coaching that you need with me or Rachel anytime you need it, through email, through a Zoom meeting, through whatever it is that you need. You get 1 year AAPC membership, as well as 2 CPC exam vouchers. You get 1 official AAPC practice exam, like that one that I showed you guys earlier. You get Practicode. So after you are certified, Practicode will go and remove that apprenticeship. Once you've completed Practicode and you have the apprenticeship removed, then you are enrolled in the HCC internship. So that will count as on-the-job experience. And then your resume services with Sarah. So once you are ready to enter the workforce or start looking, then your resume with Sarah is included. Also included here, that's not listed on the website, you get book prep to help you prep your CPT and ICD-10 manuals. You get a boot camp, so 8 hours of instruction to kind of tie everything together and just kind of do a refresher. Those are included with the course as well. Oh, Country Girl, thank you for subscribing. Definitely wish I could have found you prior to enrolling with AAPC. I know. I wish there was like a magic wand that I could just tell everybody about us before they go and make that decision. For sure. I just bought a coding course through Ed2Go. Are they not recognized? So Ed2Go's, I believe, it qualifies for the 80 hours, 80 course hours to remove the apprenticeship, but I haven't looked into it in a while, so I can't say for sure. Oh, yes. And then if you, sorry, Bobby, I thought I had already said that. If you sign up the 2,700, if you use code TRCC, it takes 10% off. So if you purchase that and you come up to the cart and then you type in your TRCC code. Oh, need to zoom back out. You type in TRCC, you can get 10% off. So it goes from 2,700, and it takes the 270 off. And then we do have to charge tax and shipping. Is anything sold separately as far as the course? Telly, are you saying that like anything? Oh, there's no shipping charges. Okay, so we just charge tax. I couldn't remember, Rachel, if you did that. So anything that's listed here on this medical coding courses page, anything listed here is available to purchase if you are not a legacy student. So if you want to purchase a study guide, if you want to purchase AAPC official practice exams, either for the CPB, the CPC, or the CRC, we do have unofficial practice questions that are written by AAPC. So these are available for purchase as well. Any of the book prep that you guys want to purchase to help prep your books, then all of that is for purchase as well. Student of legacy or not, you can do a boot camp. So if you're a student, it's included in your tuition. If you are not a student and you want to register for boot camp, then you can. And then we do have 3 different courses for live instruction. You can either do instructor-led for CPC, you can do a dual CPC and CPB instructor-led, or you can do the CPB instructor-led. Yes, we do have payment plans available. So if you scroll all the way up to the top, and then there's a financing options button here. And our financing is powered through SweetPay. So it is free to do an application. It does not do a credit check. You do have to enter identifying information just to verify your identity. But as long as you have a bank account, then everybody's approved. You do have to do 10% down. And then there is a $59 service charge. But the application itself is free. Life with Damaris Lynn. The books that we receive with Legacy, yep, they will all be physical books. 100%. As long as you are not doing a prerequisite. The prerequisites for the medical terminology, anatomy, and pathophysiology, those are ebooks. AAPC doesn't even offer physical books for those. So those are ebooks. But if you are doing the CPC, CPB, everything you get is physical copies. What if you have the books? Can you just do the course and the exams? Unfortunately, we don't offer any adjustments on our fees. What we can do if you already have your books is we can wait until 2026 and order books for you for 2026. The CPC and CPB, are you wanting instructor-led, Luna? Or are you wanting self-paced? Because that will depend. So the self-paced CPB, CPC is $3,300. And then if you do TRCC, it takes 10% off. So it takes $330. If you're wanting to do the instructor-led for CPC, then that is $4,200. And then 10% off. So that would take $420 off. Brittany, I do not at this point offer coaching for non-legacy students. Yes, Crystal, this is for medical coding. Yep. Luna, the books are included in the package. I think I answered all the questions that came in. Oh, Rachel, are you reopening tutoring schedule? Okay, so hang on. Let me go back up. Brittany. I had to figure out who it was that asked the question. Brittany. Rachel is going to open up her tutoring schedule next week. And then, Rachel, are you going to put that on the Legacy site? Are you going to reopen? Are you going to re-put the link out there on the Legacy site. I don't even remember where it was. Perfect. Okay. So okay. Yeah. So as soon as the coaching is available, then there will be a tab up here at the top for tutoring or coaching. So Crystal, you want to do the dual instructor led. So I'm trying to think of how to answer that question. It does have to be paid up front. However, you can either pay it in full or you can do financing. So the financing option, yeah, you can come up here to the financing option and that takes you to SweetPay. And then you just have to do the application. The application, again, it is not based on credit. It does not check your credit. It's not a hard hit on your credit. They just do it to verify your identity. As long as you have a bank account, then it qualifies. Tiana said, sorry if you answered, I joined late. Do you have tips for learning guidelines? ICD-10 or CPT? Allison, can you explain the difference between self-paced and instructor-led? Yes. So it's essentially the same course with one major difference, okay? So everything that's included in self-paced, the course, the textbook, the workbooks, all of your coding manuals, the book prep, I got to run through everything in my head, your membership, your exam vouchers, all of the things, right? So everything that's listed here. The difference is with the instructor-led, you get 3 hours with me as an instructor, either Tuesday night or Thursday night. 3 hours of instruction. We will go over scenarios. We will go over any questions that you guys have, anything like that. There's all kinds of time for you to, ask questions. Like I said, we spend those 3 hours in our books learning how to use the manuals, how to extract things from the scenarios, all of those types of things. So the instructor-led is just going to give you that additional support, and it's for 12 weeks. Sorry, I was trying to scroll and make sure I didn't miss any questions. Hard copy book girl, is there something similar on Amazon that you can purchase for the prereqs? You can absolutely purchase on Amazon for the prereqs. Let me pull up Amazon here real quick and I will show you which books it is. Does it have, hang on. So you will get 3 ebooks, but I agree. I'm a hard copy. I'm a physical book girl. So you will get medical terminology. And that one is by Barbara Jansen. So this is the book for the medical terminology course. So you can purchase that. The structure and function. This is the book for basically the anatomy portion of the course. And then your Understanding Pathophysiology is the textbook. And then this is your textbook for the pathophysiology section. Okay, so yeah, Tiana, so ICD-10-CM, and I see Rachel had put down there as well. I do have a series on YouTube So if you go to that link in my bio and then you go to the YouTube, and then if you go to the medical coding with legacy education, if you click here on playlists, I have an ICD-10-CM guideline review series that walks through each one of them. I'm working on the last 2 chapters now, which are very large, so it's taking me a minute to get through them. But chapters 1 through 19 are available, so you can go through and look at those. So Crystal, you need more clarity on the difference between CPC and CPB. So CPC is going to be your coding, your professional coding certification. The CPB is your billing certification. So if you do the dual course for the CPC and the CPB, then you would have a billing and a coding certification, 2 separate certifications. Yes, so Kimberly, absolutely. If you are wanting to self-study for medical terminology and anatomy, which again is this book here, Betsy Shyland, I absolutely love this book. This book is hands down probably one of my favorite resources ever from a med term and anatomy standpoint. Crystal, yes, the certifications are valid in all states. It's a nationally recognized certification. Do you recommend doing the CPB and CPC and CPP together? I think it's a good idea to do the dual certification because it gives you a very rounded knowledge of not just coding, but why first pass coding is important, making sure that we do everything right the first time, what happens before and after we code this, the claims and all of that. I think it's a good investment to have both certifications. I have billing knowledge. I taught billing a long time ago. And I am actually getting ready to sit for my CPB certification. Just that way I have the certification. But yeah, the dual certification is absolutely 100% worth it. It's a great resource of knowledge whenever you go into, when you go into interviews, then you can not only talk about the coding aspect, but why it's important to do certain things and how you can make sure that, just the whole revenue cycle is protected and things along those lines. You didn't think you would like the ebook. Of which one, Ash? Hey, Jody. Yes, Crystal. So they will email you contract details probably tomorrow whenever they return back into the office. So we do not have scholarships available at the moment. I'm trying to think here real quick. Hang on. I'm trying to do... So if you do the dual course, okay? So if you do dual, what we do... Hang on, I'm trying to respond to something here real quick from somebody else. If you do the dual course, what happens is we do a rolling enrollment. So you will be enrolled in the CPC course, and you have 12 months to complete that. And then once you are done with the CPC and you gain your certification, then you get enrolled in the CPB. So you don't have to do them all at once. You don't have to do them concurrently. You're not like trying to cram so much of the work into 1 year. You get 1 year per course. So, yeah. So Rachel and that's, I knew we were planning on it, but I didn't know if we wanted to talk about it yet, Rachel. So thanks for, thanks for saying that. Yes. So we are planning on doing a giveaway for a course of your choice, either the CPC or the CPB. One of the dual courses is not going to be included. But we are planning on doing a giveaway in a couple of weeks. So stay tuned for that. And we'll release those details shortly. Luna, so the CPB is your billing certification. Oh, okay. So the ebooks for the the medical terminology. So I don't have private coaching available, Ariana, but I do have Wednesday night. Oh, everything. So including the dual. Is that what you're saying, Rachel? Even the dual certifications are going to be included in the giveaway? Yes, and lives. Perfect. Okay. So okay. So the weekly, sorry, I dropped my focus. The weekly meetings, for the study sessions. If you go to the link in my bio, okay. So again, come up here to this link tree in my bio. These study sessions, you do have to register for them. You do have to have a Zoom account. It is 100% free to create your Zoom account. But you do have to have it, and you just have to click here and register. And then choose the meetings. You can do as many as you want. Okay? I have them scheduled all the way out through March of next year. But you do have to register, and then once you register, then it will send you a link for it. Would you say that somebody without any prior knowledge would be good at doing self-paced? We have had multiple students that have had no medical experience in any way, shape, or form. I would highly recommend that you do learn your medical terminology and anatomy prior, whether you do it with our prerequisite course or if you study on your own. I would just recommend that you do have that knowledge of med term and anatomy before you go into the course. It just makes everything a whole lot easier. Yeah, Tiana. So once you learned the med term, it's a lot for sure. But it is absolutely, 100% worth it. The discount code is TRCC. So Tiffany Roach Coding Coach, TRCC. And you get 10% off anything that's for sale on the medicalbillcode.com website. Yes, we do have a billing course. It's the CPB billing course. Yeah, go at your own pace. Read, reread, watch YouTube videos. All of that kind of stuff. Yeah, great advice, Tiana. If you are wanting to self-study for the terminology, this book here, I'm telling you guys, this book is hands down one of the best resources out there. I had the 3rd edition for the longest time, and I finally just upgraded to the 5th edition. But I'll show you guys what it looks like on the inside. So you've got the terms, you've got the anatomy, you've got illustrations, you've got exercises, and then all of your answers are back here. So this is one of the few books that gives you all of your answers. Sorry, my thing's in the way, so I can't show you everything. I keep hitting the stand. So the CRC is for risk adjustment. So the easiest way to explain risk adjustment is when you're doing risk adjustment, you're only coding conditions. You're only coding ICD-10 CMs. So the risk adjustment portion of it will come into play when like an insurance company is trying to figure out premiums. They're trying to figure out the risk of taking on that member. So when you have multiple chronic conditions or multiple high risk conditions, then your risk adjustment score is going to be higher than someone that only has one or none. So that's what risk adjustment is it's going to teach you the ins and outs of how to figure out your HCC scores. It's going to teach you all about all of the auditing processes, and it only focuses on ICD-10-CM. Yes, just Kiki. We will post everything on all platforms, TikTok, Facebook, and Legacy. Yep. We will get, trust me, the word will be out there. It will be, yeah. And Rachel, so that's a good question. That's a good thing. And I always forget to talk about this. So the newsletter, Rachel, is it on the website to sign up onto the newsletter? Yeah, down here. So if you join our newsletter, if you come down here and you put in your email, then there is a newsletter or like an email blast that goes out. So anytime we have specials, there's a giveaway, we're doing, any type of anything. If there's a new type of course offered, anything along those lines, then that email blast will have all of the information. The days to start in April. So the April start date for the CPC course is April the 3rd. Sorry, I'm trying to get to it. So these are the current start dates that we have out there. So April the 3rd is the next start date that has openings. And then we have June 3rd. And then June 26th. Those are the next 3 start dates with openings for instructor-led. Oh yeah, the newsletter, the email blast. There's also coding tips, all kinds of stuff. Make sure if you guys are on Facebook, you follow me, you follow Legacy Education. You follow both of those pages because we do a bunch of tips and tricks and all kinds of stuff out there as well. Yes, all of the courses, the CRC does not come with books because you typically will already have your ICD-10-CM. But the CPC and the CPB courses do have all of the books included. Can you explain why there's book prep and what it does to help you pass the exam? Yep. So let me show you what my book prep is. So, book prep. Let me adjust my screen a little bit and I will, how do I want to do this? Hang on. Sorry, I hit a button on my computer. So book prep. So when you get your book, it is completely blank, right? There are no notes, there are no highlights, there are no markings. But a good example of book prep is going to be this page here, right? So you have all of your parent codes that are put together, or all of your family codes that are put together that let you know that these go together. I pull some of your guideline information in here. I do some notes. I underline the things that make the codes look different or differentiate them from each other. I got it right that time, guys. I use the right term of differentiate. All of those things, okay? So that's what book prep does, is it just helps bring everything together and make it make sense. So that's book prep. During the exam, they may test you on a modifier. They may test you on the number of units to use. They may test you on whether you can code two procedures together, or if they should, one should be included and one's going to include everything else type thing. So that's what book prep does. Sorry, I moved my camera and now I'm trying to get it back. And it is not cooperating. Hang on, sorry. I'm trying to figure out. I was missing comments here. For the giveaway, could you potentially choose the internship with you guys if we didn't? If you didn't go through us, or would you just choose the course? At this point, the internship is only for people who have taken a course. The best course for beginners would likely be your CPC, whether it be instructor-led or self-paced. Sorry, I'm trying to get the screen back to where I wanted it. Yeah, so Jeannie did her Practicode with her books that weren't prepped, and she says that it helps dramatically. So I don't have a book prep class, Precious Medina, but if you subscribe, so if you become a subscriber here on TikTok and you do the $2.99 a month, then I am going to hold live sessions where we do nothing but book prep. So those paired codes that are in the groups, those are what are known as standalone and parent codes and child codes. So it just means that there's a standalone portion of the code that has to be pulled down in front of that indented code. And then if you have a code that has a plus symbol next to it, then that's just going to mean that it's an add-on code, and that one cannot be reported separately. Yeah, so the second code essentially includes the top code. So let me show you guys a page here again real quick with a simple example. So for example, well, if I can figure out, here we go. So this one here, 64650 and 64653. Your code description for 64653 is chemodenervation of the eccrine glands, other areas, face, scalp, neck, or scalp, face, neck per day. So we're going to drop this portion up here that's after the semicolon and then just pull the highlighted portion down. So we're going to use the standalone or the parent portion of the code in front of the indented code. That's what those mean. So no, the internship is not a requirement. That is just something that's included in the course if you guys want it. If you guys need the on-the-job experience, then you can absolutely do the internship and it can count as on-the-job experience. But if you already have on-the-job experience, it is not a requirement to do the internship. What other questions you guys got? What does the internship look like? So it is 400 cases. Let me get down here to it. There's a whole page that talks about our internship. It is 400 cases. It does take about 4 months to complete. You can go faster or slower. It is all at your own pace. You are only going to be coding ICD-10 CMs. So the conditions, you're not going to be coding procedures during the internship. It is only conditions. Again, you can complete it at your own pace. If you want to do it at 2 o'clock in the morning, you can. Nobody's going to stop you. You have every opportunity for coaching with us whenever you need it. Anything along those lines. Oh, Jocelyn, thank you so much for subscribing. So in order to remove the apprenticeship, you will have a couple options. Let me get on to the AAPC website. Actually, it's easier to just Google it and just say CPCA apprentice removal, because finding it on the website is a little difficult. So in order to remove your apprenticeship, you have a couple of options. Either way, it essentially has to add up to 2 years, okay? So you either have to have 2 years of employment verification if you did not take an 80-hour course. You can do an 80-hour course like Legacy Education and have 1 year of employment, or you can do Practicode. So Practicode is going to be considered as additional education experience. There's 600 cases you have to do. You're coding ICD-10, CPT, and HCPCS. Okay, so you can do an 80-hour course and 1 year and Practicode. So essentially that's what our program does, is it gives you the 80-hour course and then you do Practicode, and that removes your apprenticeship. And then if you don't do, so like let's just say you're going through a course or you're self-studying, right? So if you are self-studying, you are purchasing textbooks, you are learning it on your own, you are not going through like a structured program. Then you would take your CPC, you would have your apprenticeship, and then you would have to do either Practicode, and that would count as 1 year, and then you would have to have 1 year of employment. So in order to have your employment verification, you have to write a letter, or your employer, your supervisor, HR department has to write a letter that says how much time you've spent with the company, the experience you have achieved. It has to be on company letterhead. It has to be signed, dated, and all of that. And it has to be in a non-editable format. So it can't be a Word document. It has to be a PDF document that can just be uploaded. Is Practicode considered an internship? No, Practicode is considered education experience. And then with Legacy, the HCC internship is what is considered our internship. You're very welcome. Any other questions? Oh, sorry. I'm getting some things that are popping up here and I don't know what they are because I'm not normally looking at my screen when I'm going live. Anything else you guys want to ask about, whether it be exam, AAPC, just the process? Okay, so Jennifer says, what's the difference between CRC and RHIT? Completely night and day differences. RHIT is with a HEMA. That is going to absolutely 100% require at least an associate's degree through a CHIIM, I believe is the credential, or is the acronym. It has to be like basically a credentialed program. You have to go to a college to be able to qualify to even sit for the RHIT. That is going to be more like inpatient coding wise type thing. Ariana, yes, if you do an 80-hour structured course and Practicode, that would remove your apprenticeship. Yep. So if you take an AAPC course, that is automatically an 80-hour course. All you have to do is just show your certificate of completion for the course. In order to get your certificate of completion, you have to score 70% or better on every graded assignment within the course. If you do not pass, if you're taking it with us, with Legacy, if you do not pass an assignment with a 70% or better, we can reset that for you. So we can go in, give you additional attempts so that you can get the 70% or better, so that you will get that certificate of completion. What else you guys got? I didn't realize it was already almost 7:40. Okay. Well, if y'all don't have any more questions, then I'm going to hop off. I'm going to go do dinner. I'm going to get all the dogs settled. I'm going to do all the things and then get ready for the work week. But if you all do have any questions, do not hesitate to shoot me a message. Don't hesitate to comment. Again, anybody that's subscribed that is still on here, thank you so much from the bottom of my heart. I do appreciate it. I'm very grateful for each one of you. If it wasn't for you guys, I wouldn't be able to do what I do. So thanks for the support. And then if you did subscribe, keep an eye out each day for those subscribed or the sub only videos, things along those lines. But like I said, if you guys have any other questions, you think of anything after we're done, don't hesitate to reach out. I'm available by message, comment, whatever it is. You all have a good evening.